For many students, exhaustion, lack of sleep, and stress have become part of everyday academic life.
Hey, did you finish the assignment?
Barely. I slept really late again.
You still have that cough?
Yeah, it's probably nothing.
At first, the symptoms seemed harmless, just occasional coughing and fatigue.
You've been saying that for weeks already.
I'm okay. I just need some sleep.
You honestly don't look okay.
I've been getting fever at night lately.
Seriously?
However, the
I
cough
get tired
gradually
easily.
became persistent and was now accompanied by
Yeah,
other
you should get checked
symptoms.
already.
The patient had been experiencing persistent cough, low-grade fever, night sweats, fatigue, and gradual weight loss for several weeks. Initially appeared to be simple exhaustion, was possibly an underlying respiratory disease requiring further medical evaluation. The patient is brought to the hospital for immediate medical evaluation due to worsening symptoms.
Morning, Doc.
Good morning. So, what's bringing you to the hospital today?
Well, I have persistent cough,
Fever at night and
my chest hurts.
So, how long has it been apart?
I mean, it's been a month.
Any known exposure to tuberculosis?
I mean, my grandfather, my grandfather has pulmonary TB before.
The patient's prolonged respiratory symptoms and history of exposure raised suspicion for pulmonary infection.
So, can
The
you
physician proceeds with physical examination using a stethoscope to assess the lungs.
Again?
During auscultation, faint crackles were appreciated in both lung fields.
So,
The patient also presented with low-grade fever and mild tachypnea.
Today, sir, I will be your radiologic technologist for today. I will give few instructions so sure we get a clear and precise image. First, please remove any metal such as necklaces, earrings, buttons, or anything on your chest area because metal can affect the quality of the x-ray. Sir, I will position you properly in the x-ray detector. So please put your chest on the board like this. Make sure your shoulders relax and roll slightly forward.
The
This helps
radiologic
separate,
technologist
lungs
ensures
and
correct
clear
patient
image.
positioning,
Okay,
proper
sir.
breathing technique, and radiation safety protocols to produce a high-quality diagnostic chest X-ray image.
Take a deep breath. Inhale, exhale, inhale, hold your breath. Okay, sir, it is done. Thank you.
After the
your
radiographic examination, the chest image was reviewed by the physician for abnormalities within the lung field.
Normally, the lungs should be appeared relatively dark on radiograph because they contain air. However, these multiple small opacities indicates widespread infection within the lungs.
These tiny white nodules produce what is commonly described as a millet seed appearance, which is characteristic of miliary tuberculosis.
So the infection isn't only in one area? Yes, unlikely. Localized pulmonary tuberculosis, miliary TB, involves diffusion and distribution throughout both lungs, which makes the condition more serious.
Is it dangerous?
Yes, miliary tuberculosis, that tuberculosis is treatable, especially when diagnosed early.
Is it dangerous?
Yes, miliary tuberculosis is considered serious form of TB because it can spread rapidly and may also affect your other organs and left untreated.
So what happens now?
First, I want you to understand that tuberculosis is treatable, especially when diagnosed early. I know this can feel overwhelmed, but you're not alone in this. The important thing is that you sought medical attention before the condition become more severe.
Will the recovery takes longer?
The treatment does not take time and consistency. You need anti-tuberculosis medication regularly for several months, and follow-up monitoring will also be necessary.
Last question. Will I recover normally?
Many patients recover well when they follow a treatment plan properly. Your body just needs time to rest and support. Right now, you should prioritize adequate rest, proper nutrition, hydration, making medication consistently, avoiding excessive stress and exhaustion. Your immune system is already working hard, so take care of yourself is very important during recovery.
Can the infection spread?
Yes, tuberculosis can spread through airborne droplets, especially through coughing, sneezing. That's why wearing a face mask, observing proper cough etiquette, and avoiding close exposure while still infectious is important.
Honestly, I think it was just stress and lack of sleep.
A lot of people ignore early symptoms because they seem mild at first. That's why persistence, cough, fever, unexplained fatigue, and weight loss should never be neglected. You did the right thing to get checked up. Early diagnosis makes a very big difference.
In this case, what began as a simple cough turned out to be a serious pulmonary condition detected through chest radiography. Early recognition of persistent respiratory symptoms combined with proper imaging plays a crucial role in timely diagnosis and treatment. Don't ignore symptoms that don't improve. Early consultation matters.